what happens under breast augmentation and what is the cost incurred into it?
Breast augmentation, as the name implies, is increasing the size of the breast. There are many women who developmentally have very small size. They could have a double A or an A cup, and because of that, they lack confidence. And these are the women who would benefit tremendously by having an augmentation mammoplasty or a breast augmentation procedure. Now, there are two ways of augmenting the breast. Uh, First, let me just make it clear that once the developmental age of that girl is over, that is, puberty is over, like 16 to 18, there is nothing non-medical that will work. During that period, maybe there may be some medicines that may work, but after that, then it's only surgical. And the surgical options are either you can augment the breast by fat grafting or using a silicone implant. Now, fat grafting is a procedure where we harvest fat cells or take fat cells by liposuction from the area where it is in excess, and then that is processed and injected into the breast. What you get is around a cup increase at the end. So, first of all, many girls, they hardly have any fat on them in that age group, so they may not have enough fat to have a significant augmentation done, or they don't get a significant improvement, that is, 1 cup improvement is not satisfactory for them. So in that case, then they should go for silicone breast implantation. And silicone breast implantation is a procedure that's been in vogue for the last 40 to 60 years, and it's one of the most popular procedures done in the West, and it's a most satisfying procedure if done properly by trained surgeons. The silicon implant is a basically very inert material. It's like a balloon, which could be pear-shaped or round. It has got a silicon outer coating, a special wall which prevents leakage, and then the current generation content of this is a cohesive silicon gel. Cohesive silicon gel is like a jelly of silicon that doesn't run even if you cut the bag, and it stays in its place, but it gives you a consistency and firmness that is similar to a nice firm breast. Now, this implant is placed through an incision, either under the breast tissue or underneath the chest muscle, pectoralis muscle particularly. Where we place it would depend upon my clinical judgment, but we prefer to place in these skinny people underneath the breast chest muscle, and this is called a dual plane augmentation, and that helps the chest muscle to cover the implant from the top. So even if you don't have adequate breast to cover the implant, it's not visible. So we specialize in giving absolutely natural results and long-lasting results, because the research has shown that if the implant is covered with satisfactory tissue, then you have less problems such as rippling or visible implant or tissue complications that one tends to get. So dual plane is what we specialize in. If the lady has adequate soft tissue to cover the implant, then we may place it underneath the chest muscle, the pectoral fascia. So this is what is done in breast augmentation. You can get any cup size. We here spend a lot of time here in assessing what are the needs of the patient, what are the dimensions of the breast base template, what is the quality of the tissue, and what size implant they will take. We even give sizers, we do morphing. So many parameters are used to assess what will be the right size for the patient, and we ensure by doing all of this that the patient will be happy with the size and the shape that they have after the surgery. It's a day surgery procedure with us. Recovery is anywhere from maybe 2 weeks to 3 weeks time, and once all the swelling has gone, the breast becomes soft and firm, basically, with a lovely shape, and it's a permanent improvement that doesn't change even with age. So that's the beauty of this, and the cost of this procedure depends upon the implant that is used. There's an insertion cost and an implant cost. So the insertion cost can vary from anywhere from 80,000 to 1.2, depending upon what all is being done in the procedure. 80,000 to 1.2 lakhs of rupees, and then the implant cost varies from manufacturer to manufacturer, and it can vary from anywhere from 30,000 to 80,000 rupees. But by and large, if you put a round implant of a good reputed manufacturer with which is US FDA approved, Indian FDA approved, then it would be around 55,000 a pair of implants.